Healthcare leaders are facing challenges as COVID cases spike. Many local hospitals are dealing with staffing shortages because of the Omicron variant. ABC 13's Courtney Carpenter is live in the medical center with more on what is being done to ease the burden.
Well, Myra, these hospital leaders tell me that the new CDC guidelines cutting down on the number of days in isolation will help with the problem. And they say, thankfully, most of the workers who have COVID right now are experiencing mild symptoms. But bottom line, hospitals across our region, many of them are stretched thin right now because of the Omicron variant.
We have just over 1,200 employees right now who are out with Omicron. That's of our 26,000 employees. So while it seems like a small percentage, that does impact some of our ability to staff every one of the beds that we'd like to have open at the present time.
Roberta Levy-Schwartz, the executive vice president at Houston Methodist, says each surge of this pandemic has been a bit different from a healthcare standpoint, but never has she had this many employees infected with the virus at once.
This is definitely new for us. I think our largest number that I can remember in the past was a little over 300.
Which in turn will impact how long you'll wait when you need care.
Waits for sometimes our virtual urgent care, sometimes that is up to 4 hours to wait to get on a virtual urgent care. Those are appointments in the past that you could probably get in 12 minutes.
Within the Harris Health System, 415 healthcare workers are out sick with COVID today, up from 393 yesterday, all while hospitalizations are up too.
At the end of November, just about a month ago, Harris Health System had a total of 14 COVID positive patients. That number this morning is 97.
And another current problem, people showing up to emergency rooms wanting to be tested for COVID.
This is not the time to come to the emergency rooms for non-urgent, emergent health situations, and it's definitely not the time to be coming to the emergency rooms to get tested for COVID.
Yeah, both of these healthcare leaders just stressing for folks to go to testing sites and not the ER to get tested. Besides the staffing shortage, pretty much if you show up to an ER to get tested for COVID, if you don't have COVID, likely by the time you'll leave, odds are you'll be exposed, just creating an even larger problem. Reporting live in the Med Center, Courtney Carpenter, ABC 13 Eyewitness News.